All right. So we're looking at some subtypes of oral routes of drug administration. So most people, when they hear oral route of drug administration, they might feel like if I give you the drug through the mouth, the patient must actually be swallowing it. Not really. Sometimes you can be giving the drug just beneath the tongue, that's sublingual, or you can be giving inside the cheeks, that's what, buccal. Why will you be giving the drug at those places? This is because these areas are highly vascularized, or the blood supplies in these places is so high, so you want to actually give a drug there so that it dissolves slowly and it absorbs very fast. So the sublingual and subbuccal route of drug administration just simply involves you are placing medications in the oral cavity. That's the subbuccal. Oral cavity. That's the general. So oral cavity now, it can be in the cheek, it can be under the tongue. So where they actually dissolve and absorb. So the drugs is actually absorbed directly into the bloodstream through the mucous membranes. So breaking it down now, for the sublingual, it's under the tongue. So there's rapid absorption through the highly vascularized, or there's like the high blood supply, that is under the tongue. So examples of drugs that can be given for this sublingual is nitroglycerin, right? That is used in managing angina. Then buprenorphine, that one is basically for opioid dependence. Then lorazepam, used for managing anxiety. Right, so these are examples of drugs that you place it on the tongue for delivery. Then for the buccal, that's like inside the cheeks, So placement is between the cheek and the gum, Like just put it between the cheek and the gum, right? Slow. The absorption here is actually slower though, But basically, the advantage is actually bypassing the first pass effect. So examples of medications that can be given like inside the cheeks, we have things like the fentanyl buccal tablets, managing pain, testosterone buccal patches for like hormone therapy. So what's the advantages of using these two routes of drug administration? Of course, they actually absorb faster, so the onset of action is actually faster, especially the sublingual. You are not taking it to the stomach, it's not passing through the liver, so you are dodging the first pass effect. That's why they say bypass. It's useful for patients that have problems with swallowing, or they have problems with their GI tract, finding alternatives. Disadvantages is you can actually load a lot of drugs. It's just little quantity, right? It may actually affect the taste of the patient. The drug is so bitter, It requires proper technique to ensure absorption, right? So that's it for these two routes of drug administrations.